For whatever reason, presidents like to declare war on nouns, like the war on terror and the war on poverty, just to name a few. The wars never really end, though. They're ongoing. President Richard Nixon's war on drugs started in the early 1970s, with reinforcements coming from President Reagan back in the 1980s. Back then, the front lines were with the cartels, trying to stop cocaine and marijuana crossing our borders. Today, there's a new enemy, or at least a new offensive from the enemy, better known as the opioid crisis, highlighted by a synthetic opioid called fentanyl, which is becoming an increasingly popular drug on the streets. Whether drug dealers are targeting kids with colorful pills, well, that was the focus of our story this week. But that also sparked this email from Paul. Why, in all of your reporting on fentanyl, are you not including percentages of legal prescription overdose deaths and illegal street drug overdose deaths? It seems to be intentionally skewed to reflect the current quote-unquote war on drugs. I would love to know those numbers, and it might shine a light on prescription drug abuse, which we know is a problem. So it's a good time now to bring in Andrew Bartline, who basically took this question and went out to find an answer. So how does prescription overdose, all those prescription overdoses, compared to what we're seeing as recreational overdoses?
Well, it's tough to know specifically because the way the numbers are sort of divided up by the Department of Health and Welfare. That's the folks who track these sort of things. Now, the most complete recent data is from 2021, where more than 5,000 people total visited an emergency department for a drug overdose. Of those 5,000, it was 353 people in total who died from a drug overdose in Idaho. We know that 152 of those deaths were linked directly to fentanyl. In total, Idaho had 89 other opioid overdose deaths. Now, if we want to put those into percentages to make it a little more digestible, fentanyl accounts for 43% of drug overdose deaths in Idaho. Other opioid overdoses, it's a little more than 25%. So 1 in 4 is not a small number. But these other opioid overdose deaths in total, that number doesn't give us any context. How and why are people overdosing? Because we know of those 89 other opioid deaths, prescription drugs are a part of the puzzle.
Prescription drugs is that they are prescriptions, so sometimes there's a misconception that they're safe because a doctor prescribed them to you. They can have a confounding effect where you can get kind of more sleepy on them, which then can in turn lead to these unintentional overdoses, which we do see actually a fair amount, which is why there are a lot of recommendations and restrictions in prescribing these to patients unless truly indicated.
I mean, there were more than 5,000 overdose visits to emergency departments in 2021. I mean, there's 365 days in a year. 5,000 is a lot. So do you see this every day in your work?
Yeah, I mean, this is something we do all the time. You know, we give Narcan, and if we can reverse patients and it was just a light overdose, sometimes we can send them home, sometimes we have to admit them, and sometimes we have to tell their family members that they died. I had a patient just last week, normal person with a family, with a job, that came in and overdosed on their home prescription medications, and I could not get them back despite all of the efforts. So yes, street drugs, fentanyl are a concern, but these prescription drugs are a very big deal as well. And don't forget that they're also a huge offender, and to be very wary.
What do you think maybe could happen or maybe could change? I don't know what Idaho's laws are right now, but that's got to be tough. What can change? What would you like to see change?
I mean, most of our practice in the emergency room, I mean, we're pretty restrictive in giving them out. Like I said, really low quantities and only under certain circumstances. And there are some patients that are mad at us for not giving them more pain medications. I think it's also just reshaping our view of pain as a society. You know, if you fall down and get hurt, you're going to have some pain for a couple days, but taking a narcotic or one of these sedating drugs, it actually doesn't help you get better any faster. It makes you feel high, it makes you feel good, but it actually doesn't go to the area of inflammation and make it get better any faster.
There are people that get prescribed something and intentionally abuse it, but there are also people that maybe just aren't following what they were told to do and then can abuse it by accident. You see both of those.
I mean, that's human nature. You know, I think it's hard. Being in pain is really hard. And, you know, if you're told to take it every 4 hours and you're feeling like you're in so much pain and you need to take it more, well, that's probably the time as doctor to come back into the emergency room for us to figure out, another creative way to treat your pain instead of just sitting at home taking more. And that's actually what I tell my patients. I say, if you're finding that you're needing to take a lot of these stronger narcotic pain medicines at home, then you probably need to be back in here and we need to talk about what's going on. These prescription medications do have really detrimental effects. They're very addictive, and that they should not be a first-line treatment in treating pain.
So yes, people are abusing prescription drugs and it can kill them, and that is happening here in Idaho. People also aren't careful with their prescriptions. They may take extra pills to manage what they perceive to be excessive pain. Being careless, that too can kill them. Other states have laws only allowing physicians to prescribe an opioid for broken bones or if someone is dying of cancer. Those are kind of the only two reasons. States like Nevada, Dr. Kroll says when she was practicing there. She also says the Idaho Board of Pharmacy does not have those kinds of restrictions here in Idaho. But we've gotten to the point, Brian, where if you go and you get a prescription for opiates, you say, I don't know, you get prescribed Vicodin, let's say. If there is a perceived risk by the physician, or if a family member brings up, we have a concern, when they give you your pills, here you are, Brian, they will also hand you Narcan in case that there is an emergency, you accidentally overdose, or you abuse the drug and overdose. So, they're almost coming hand in hand at times when they feel need be.
That is interesting. All right, I didn't know that.
Yeah.
All right, thank you very much, Andrew.